Hi, I am Giselle, and this is my presentation about the state of the HIV epidemics in the Philippines, progress and challenges in 2023.
Millions of people live with HIV, a disease that weakens the body's defense against ordinary infections.
The body's defense is the immune system, made up of white blood cells, antibodies, and other cells. CD4, a type of white blood cell, fights off invaders.
But HIV attacks CD4 cells. The HIV life cycle begins when HIV attaches itself to the CD4 cell and transfers its proteins and genetic materials into it.
Next, an HIV enzyme called reverse transcriptase converts HIV RNA into HIV DNA, while an integrase enzyme integrates HIV DNA into the host CD4 cell's DNA.
Then, the protease enzyme processes the produced HIV material for assembly into an immature virus.
Finally, mature HIV materials are released into the body, where the cycle starts over again.
There is no cure for HIV, but antiretroviral medication or ARVs reduce HIV reproduction by interrupting the HIV life cycle.
Entry inhibitors prevent HIV material from entering CD4 cells, while reverse transcriptase inhibitors stop the reverse transcriptase enzymes from converting HIV RNA into HIV DNA.
Later, integrase inhibitors block HIV integrase enzyme from integrating HIV DNA into CD4 DNA, while protease inhibitors block the protease enzymes from enabling the production of new HIV material.
By learning more about HIV and ARVs, you are better able to adhere to HIV treatment and protect others from getting infected.
In the past decades, the Philippines has gained notoriety as a country with the fastest growing human immunodeficiency virus or HIV epidemic in the Western Pacific region. While the overall trends of HIV incidence and acquired immunodeficiency syndromes or AIDS-related deaths are declining globally, an increase in new cases was reported to the HIV/AIDS and AR2 registry of the Philippines. From 2012 to 2023, there was a 411% increase in daily incidence. Late presentation and care remains a concern, with 29% of new confirmed HIV cases in January 2023 having clinical manifestations of advanced HIV disease at the time of diagnosis. Men having sex with men are disproportionately affected. Various steps have been taken to address the HIV epidemic in the country. The Philippine HIV and AIDS Policy Act of 2018 or Republic Act 11166 for the expanded access to HIV testing and treatment. HIV testing now allows for the screening of minors from 15 to 17 years old without parental consent. Community-based organizations have been instrumental in expanding HIV screening to include self-testing and community-based screening. The Philippines moved from centralized HIV diagnosis confirmation by Western blot to a decentralized rapid HIV diagnostic algorithm. Dolutegravir-based antiretroviral therapy is now the first line. Pre-exposure prophylaxis in the form of N-tricetabine, tenofovir, desoproxil fumarate has been rolled out. The number of treatment hubs and primary HIV care. Despite these efforts, barriers to ending the HIV epidemic remain, including continued stigma, limited harm reduction services for people who inject drugs, socio-cultural factors, and political deterrence. HIV RNA quantification and drug resistance testing are not routinely performed due to associated cost. The high burden of tuberculosis and hepatitis B virus co-infection complicate HIV management. CRF01AE is now the predominant subtype, which has been associated with poorer clinical outcomes and faster CD4 T cell decline. The HIV epidemic in the Philippines requires a multi-sectoral approach and calls for sustained political commitment, community involvement, and continued collaboration among various stakeholders. In this article, we outline the current progress and challenges in curbing the HIV epidemic in the Philippines. Needle and syringe programs provide access to sterile needles and syringes and facilitate their safe disposal. NSPs have been shown to effectively reduce HIV transmission. However, the implementation of NSPs remain difficult in the Philippines, given that the Comprehensive Dangerous Drugs Act of 2002 or Republic Act 9165 considers any unauthorized possession of drug paraphernalia as prima facie evidence of self-administration of dangerous drug. Violation could lead to a maximum of 4 years imprisonment and a minimum monetary penalty of 10,000, which is higher than the upper bound of the average monthly minimum wage in 2022. Political pressure on the Dangerous Drugs Act of 2020 continue to make NSPs inaccessible, deterring effectively community-based comprehensive HIV prevention services among PWID. The Big Cities project in Cebu, funded by the World Bank and the Asian Development Bank, aimed to reduce HIV transmission by reducing risk behaviors among PWID. However, the sterile needle distribution aspect of this project was halted within 5 months of implementation due to political pressure. Mental health and substance use disorders need to be addressed as part of a comprehensive response to the HIV epidemic in the Philippines. Data from the Young Adult Fertility and Sexual Health studies show that 1% of Filipino men and 0.03% of women aged 15 to 24 years paid for sex in 2021, while 1% of men and 0.1% of women received. High-risk behaviors were also reported in this survey, with only 13% of male youth using condoms every time they paid for sex in the past 12 months. Vulnerable population are more likely to engage in transactional sex. For instance, female sex workers previously constituted majority of the HIV cases during the early part of the epidemic. Moreover, around 38% of MSM and transgender women surveyed in the IHBSS 2018 reported receiving payment in exchange for sex in the past year. Additionally, sex work has been reported outside of urban areas as demonstrated by the call boys in rural fish ports. Although commercial sex work is illegal in the Philippines, transactional sex encompasses non-marital, non-commercial sexual relationships motivated by the implicit assumption that sex will be exchanged for material benefit or status. Alcohol, drugs, monetary gifts, and housing have also been implicated as driver of transactional sex. Young people who engage in transactional sex have been increased risk of alcohol and substance use as well as of HIV and sexually transmitted infection. Given the success of community-led HIV testing projects, HIV self-testing was included in the National HIV Testing Guidelines in the 2022. However, challenges remain in the rollout of HIV self-testing. Most of the HIV self-testing kits in the Philippines are blood-based tests, despite the acceptability of oral-based tests. Moreover, there are unauthorized online sellers of HIV test kits. Regulations must be strengthened to ensure the quality of HIV test kits purchased online. Furthermore, support system must be in place to facilitate linkage to care, making medical and psychosocial support accessible for persons who test positive at home. For several years, the only available one-pill once-a-day ART regimen in the Philippines has been lamivudine TDF, efavirenz, LTE. Although efavirenz is a potent non-nucleoside reverse transcriptase inhibitor, it is known to cause neuropsychiatric symptoms such as vivid dreams, severe depression, or suicidal ideation, which have been reported in up to 50% of patients. In July 2019, the WHO issued a statement that the integrase transfer inhibitor or INSTI dolutegravir is the preferred first-line and second-line treatment option for all populations. This was based on multiple studies showing that dolutegravir is more effective in achieving virological suppression, is better tolerated, and is more effective than alternative drugs. Furthermore, dolutegravir displays potent in vitro activity and a lower barrier for genetic resistance development. Where resources are available, baseline HIV drug resistance testing is recommended to guide the selection of the initial ART regimen. HIV genotype testing is also helpful to facilitate the switching of medication in the event of treatment failure. However, low and middle income countries face challenges in accessing HIV drug resistance testing. In 2013, deep sequencing analysis to assess drug resistance mutations among PL-HIV in the Philippines showed that only 2 from the 110 evaluable individuals with major HIV variants were highly resistant to non-nucleoside reverse transcriptase inhibitors, or NNRTI, efavirenz, and nevirapine. However, minority drug-resistant HIV variants were detected, highly resistant to nevirapine, 89 out of 110, rilpivirine, 5 out of 110, and efavirenz, 49 out of 110. A study published in 2017 among a relatively small sample of treatment-naive PL-HIV in the Philippines, N is equal to 95, showed transmitted drug resistance, or TDR, in 6 patients, 6.3%. In a more recent publication of PL-HIV, number is equal to 513 on ART, 10.3%, 10.3% experienced treatment failure after 1 year. Among those who failed treatment, number is equal to 53, or 90.6% had BRMs. The study found unexpectedly high rates of NRTI, NNRTI, and K65R tenofovir resistance, as well as multi-class resistance. This data emphasize the need for continued efforts to increase viral load and drug resistance testing in the Philippines.